Hi, everyone, and welcome. I'm Megan Chase, Share Cancer Support's Breast Cancer Program Director and host of our BC Life podcast. And I'm also an AYA breast cancer survivor. Now, before the conversation begins, I'd like to tell you a little bit about Share. We're a national nonprofit that supports, educates, and empowers anyone diagnosed with breast or gynecologic cancers and provides outreach to the general public about signs and symptoms. Because no one should have to face breast, ovarian, uterine, cervical, or metastatic breast cancer alone. For more information about upcoming webinars, support groups, podcasts, and our helplines, please visit our website at sharecancersupport.org. Now, for those of you who may not be familiar with the term AYA, in the cancer space, it stands for adolescent and young adult, meaning anyone diagnosed with cancer under the age of 40. Being part of the AYA community comes with its own set of unique challenges and experiences. So I am super stoked to be joined by two amazing guests, Megan Scherer, Executive Director and co-founder of the nonprofit Worth the Wait, and Kara Bendle, an RN and program manager for AYA and Fertility Preservation at the Cleveland Clinic. So before we dive into this conversation, each of you take a minute to introduce yourselves. Megan, let's start with you.
First off, Megsy, thanks you so much for having us here today. This is such an important conversation and thrilled to, impart our knowledge on others to, inspire hope. So my name is Megan and I run Worth the Wait. We are an onco-fertility charity providing financial assistance to AYAs who need to preserve their fertility. And then also in family building, we give financial assistance grants to help with everything from surrogacy to adoption and everything in between. And I'm really passionate about this topic because my husband is an AYA cancer survivor. And so starting our family was very challenging. And we just decided we needed to do something to inspire others to go on that journey.
Thank you so much, Megan. And I'm also thrilled to say that I sit on the advisory board of Worth the Wait. So let me kick it on over to Kara. Let's hear from you.
Hi, everyone. Meg B, thank you again for having us on today. I am so honored and excited. I wear two hats in my role. I am a program manager for adolescent and young adults, focusing on all the psychosocial supportive services that an individual may need during treatment and beyond. And then I'm also the fertility preservation program manager. So anytime someone gets diagnosed with cancer, to look at their treatment plan, determine how toxic it is to either their eggs or their sperm, and if we need to do anything to help preserve fertility if they choose as an option for the future. I'm also on the Worth the Wait advisory board, and it is knowledge is power, and I'm so thrilled and excited to be able to spread knowledge to give others power.
100, right?
Right.
So, a cancer diagnosis already feels like a betrayal that is compounded by an infertility diagnosis. So, let's talk about the body betrayal for both male at birth and female at birth individuals in the AYA cancer community. Kara, why don't you kick us off with what it means in terms of family building, and then we'll toss it over to Megan.
Family building, especially in today's days, is expansive between someone who chooses to have a biological child either from their own body or their partner's body or a surrogate or through adoption. It can be very complex and it's different for each individual person depending on what they choose and how they choose to expand their family. Family building is also very unique in a sense that it does look different for everyone, but also can include our furry babies, being an aunt and uncle. And so, what defines someone's family building and how they want to build their family is so uniquely different. And I always want to stress to individuals to follow whatever path works best for them, and always maintaining options to have that any type of path that they would want.
Megan?
I love that broad definition. And I'll just throw in one other idea. I was talking to a survivor of ovarian cancer a few weeks ago, and she is actually doing faster parenting. And she was diagnosed beyond the AYA years. And this is just a really natural progression for her. And she just loves being able to have so many children in her family and be able to provide that. So yes, there's so many options out there. And if you didn't have a chance to preserve fertility beforehand, there's a lot of emotions around that. And what we like to do is, empower and educate people so they know that there are so many other options available, even if that one is not available to them.
And I do think that that's kind of the premise for where body betrayal can happen as we grow, and as we see families being built as we're growing up. I was just thinking about this the other day when I was at a birthday party with my daughter. There were two individuals talking about IVF, and we were listening, and my daughter was listening, and I was thinking about how in the 90s, I would have never heard that conversation at a birthday party before.
Mm.
And just how that those conversations can shape someone's view for family building and what their own bodies can do. It's really detrimental, not only when you have that cancer diagnosis, but then also the fertility piece with it as well. That it's earth shattering because it's the way you were molded unintentionally as you were growing up.
That's so true. And when you get a cancer diagnosis under 40, like you may be at different stages within your life, and you may not even be thinking about your fertility at that time, and how this can kind of feel, kind of foreign to you. Like, I never really talked about IVF for myself. I am an IVF result. My parents did IVF, and on the third round, the miracle of moi appeared. But it is really hard to even think about that once you have that diagnosis. So, when we think about significant others or spouses of an AYA patient who was male at birth, what are some of those specific challenges or misconceptions about impregnating their partner or spouse, right? Like, Megan, let's start with you because you have experienced this with your husband, Mike, who, as you said, is an AYA cancer survivor. Why don't you tell us a little bit about that and what some of the male applicants for, Worth the Wait and grantees experience?
Yeah, that's such an important thing to talk about. So I think in my personal situation, my husband had a lot of guilt around the fact that we had to do fertility treatments to conceive because, all the the damage and, yes, he was there giving me the shots, but my body was, taking the brunt of the pain and the medicine to be able to have a child. So I think he certainly had a lot of emotions around it. I certainly had a lot of emotions around it. But he really felt helpless because he did this to me essentially when, of course, I didn't see it that way. But, there's two perspectives and in every type of relationship. So that was really a struggle that I don't think a lot of people are talking about. When it comes to our grant recipients that we're helping, we've helped several male cancer survivors purchase donor sperm. So that is, a whole nother level of complexity of going through the fertility treatments and then using a donor sperm, selecting that. But it's really something that more people are reaching to because the female partner wants to be able to carry the child. So it's a really great option and something that's a lot more accepted. And there's support groups around, the parents who are using donor sperm and eggs, and then also the babies that are born using them.
Kara?
I think to add to the guilt is definitely something that I feel like can be very burdensome and a very, very strong reaction. And I also feel that it goes back to some of the ways that we view fertility for male at birth individuals. So we think about, how society always says, oh, men can have birth, can impregnate someone at any point during their lives, oh, up until they're, 80, 90. And so it's just that perception that's been shattered that, hey, this isn't what it looks like. And as we kind of alluded to earlier, growing up, you're not sitting there thinking like, I'm gonna grow up and do IVF to build my family. You hear, oh, I would really like to look into fostering. I would really like to adopt, or I would really like to have biological children. But the IVF piece, I feel like, is very, very missing in that dialogue as we are growing up and as people are growing up now. But I go back to that perception of, oh, well, can have kids at any age and impregnate at any age and all of that, those words and those sayings.
As we think about all the complexities of just the AYA cancer experience, another huge part that is not talked about enough, right, is how deeply personal the fertility aspect is when diagnosed with cancer under 40. Megan, can you tell us what have you experienced with worth the wait applicants and grantees who desperately want to try and preserve their fertility and the emotional feelings and the financial barriers that they are often up against?
Yeah, it is such an emotional piece of, the cancer journey, I would say. We get applications and we get people requesting applications every day, and they will share the most personal details, in those messages. And the things that we're routinely hearing, number one concern is, am I going to survive this cancer? Beyond that, it's what is my family going to look like? And will I be able to have, that picture that I had in my head? And, we hear from many more of the women of, I've always wanted to be a mom. Every once in a while we get a male that's, oh, I've always wanted to be a father, or I'm a teacher and, kids have always been part of my life. But it's typically the female that has had that picture in her mind for a long time. So it's very emotional. And then, when they find out the costs associated with egg freezing or embryo freezing, that's just another barrier to that hope and dream of the future. But the one really great thing that I hear a lot of is once they go through with the egg freezing, they say, this is what's motivating me to get through every day in the chemo chair, or, whatever that surgery or next treatment is. They have that to look forward to. One of our grant recipients, she has several embryos on ice, and she came up with the names of all of her future children during her cancer treatment. So I think that can really just help, your mindset to look forward to that if you have the chance to do it.
I'll talk about also that hope, as well. Kara, you had mentioned that many of the female at birth patients feel that their value and worth is dependent on their ability to get pregnant and maintain a pregnancy. Can you go deeper into what that means for AYA patients.
Yeah, well, it's such, as we keep mentioning, it's such a complex layer between personal feelings, but also societal expectations, personal expectations, and just really, I feel the complexity is compounded by you're also thinking about not only the what your future will look like, but making sure that you're still alive to see that future with a cancer diagnosis. You're thinking about like, hey, am I going to be here this time next year? And sometimes that does impact someone's ability to make a decision about fertility preservation because they're like, oh, hey, I should really be focused on the cancer piece. I'll deal with everything else later. When in actuality, the importance of maintaining their fertility and maintaining an option becomes very heavy during survivorship. And I'm putting that in quotations because we all know sometimes in the community we don't like to use that phrase. But off treatment, and they're like, oh man, maybe I should have paused. And there's this regret and this huge emotional burden on I should have paused for a couple more days, or could I have paused? And it's a lot of coulda, shoulda, woulda. And so I think that's where Worth the Wait and individuals like myself in the healthcare system, where we really need to advocate for maintaining that option. And it's very complex with that feeling of this determines my worth as a female at birth. I was born with this this organ that houses this pregnancy or maintains this pregnancy, and now I can't do that when I want to do that, or my partner really wants that. It just means so much, not only sadness for individuals, but just an immense amount of pressure. And it's also an unreal, like you can no longer achieve that. Like it's something that it's out of reach. It's no longer an option, and there's nothing you can do to change it. And Megan and I were actually recently at an event where, and it completely blew my mind. We were talking about how this complex situation is a justice issue. To have someone become infertile, sterilized, unable to have children after a treatment is a justice issue. And I've never thought of it in that way before, but it's just been very profound in my mind recently of when I'm advocating for patients and advocating for fertility preservation to be a standard of care so that people, while they're in their off treatment survivorship phase, they can have the best quality of life. And some people really can't have that quality of life not being a parent in some way, shape, or form, or family building in some way, shape, or form. And that biological piece also is very compounding for people in another type of hurdle and mental barrier to work through as well. I'm not sure if I really answered the question because it's so complex. It looks different for each person, but I think when we're thinking about the entire spectrum, from the ability to get pregnant, the ability to maintain a pregnancy, the biological factor, it's so compounding, and how we expect people to manage that after receiving treatment to cure their cancer. It's a justice issue. It's inhumane.
Megan, I'd love to hear more about your feelings on that. That's my first time really hearing about like a justice issue. And what I'll say for myself and going through this and I was diagnosed at the older end of the AYA age, and I was single. And so in my mind, I'm like, I can't even think about kids right now. Like, what are you even talking about? And to this day, I will always wonder I do have some regret. Like, first of all, I didn't know that I wanted it that much until really like the choice essentially
Right,
was taken away.
right.
And I wasn't prepared for that kind of grief and that permanence that you were talking about, right?
Yes, yes, the permanence, the like, you can't go back. Like it is fact. It is done.
That's it. Yeah, like that's it.
The finality of the situation.
Yeah. And to also what it feels like to physically feel empty. That is something I to this day, I was not expecting, and I'm still dealing with it. And so, Megan, when we think about like you and Mike, what y'all went through, and the conversations that the two of you have had, and then the conversations eventually that you'll have to have with your own child, with your son, can you kind of walk us through what goes on in your minds? What kind of conversations are you having? And what are some of the grantees saying?
Yeah, yeah. Our son is 8 now and he's very involved in Worth the Wait. He always wants to know, where the people live that we're helping and the stories and what their jobs are and all the fun facts, of the community that we're serving. So, we're really open and honest with him about it. I told him yesterday, I was like, oh, there's a new grant recipient and he's having a baby. And he goes, wait a minute, mommy, he's a boy. And I was like, well, his wife is having a baby, but we'll have other conversations around all of that in the future.
Mm,
So it certainly has been an emotional process, and Mexi, I'm sure for you too, just talking about it in your professional role, I think compounds that. And for me and Mike, we kind of thought we were past all of that. And then when we started Worth the Wait, we were like, oh my gosh, we have to get into this and think about this every day. And it can be taxing and it can be overwhelming and brings up more, emotions for me. Like Mike and I never wanted to just have one child, but we went through more fertility treatments and it wasn't possible. So, I get a ton of questions about, well, why do you only have one child? And it brings up an opportunity to talk about oncofertility with people who, they had no idea that they were pushing my hot button when they asked me that. Um, and then I want to share some of the things that we've heard from the patients that we're helping. Megzi, like you said, having that emptiness feeling. I was talking to a Worth the Wait grant recipient 2 weeks ago, and she's a cervical cancer survivor, and she woke up from her hysterectomy and she was just sobbing. And she wasn't expecting to feel that emotion, coming right out of anesthesia. I've talked to other patients who are breast cancer survivors, and they're really nervous about if their doctor clears them to do, to have a pregnancy, that fear of reoccurrence. There's lots and lots of conversations about that going on. And then I've also heard people talking about, depending on what type of mastectomy, if they needed one for breast cancer, having one breast and being able to breastfeed. And if you're not able to do that, what is the guilt? What are the societal expectations that are put upon you when your body has essentially betrayed you and you're not able to do that? So I think it's like even if when the child arrives, there's still so much more to handle emotionally. And honestly, it's just like one of those things that survivors that have to take the brunt of it. And unfortunately, you know, deal with the hard questions and the uncomfortableness around it.
mm. I mean, right? Kara's like,
We're all
yep.
you. It's not funny, but yeah.
Um, in thinking of survivorship. And I am one of those people, like, I used to be, yes, I beat cancer. Yes, I did all of this until I started to realize, wait, this is really never over. Like we've talked about that fear of recurrence and then other health issues, having other surgeries, and something that I experienced too was because my body seemed to be intolerant of the medications for premenopausal women, because I wasn't yet 40, and then having to be surgically moved into menopause. And all of that, I think about those emotions. I wasn't thinking about, oh my God, what's going to happen when I wake up? I was more like, I can't go through this cancer again. Let's just do what we need to do and get it out. And I was not thinking emotionally at that time. And so, as we think about like that anxiety that we can have uh, around like survivorship and that quality of life, but then also in thinking of those who really want a child and parenting, like what are some of your thoughts on survivorship and trying to help ease that anxiety, because now that there is more information out about how to preserve your fertility, it can still be a really hard conversation to have. And then it's like you do sometimes have to constantly explain yourself if you only have one child or if you don't have any children. Kara, Megan, jump in.
Survivorship, as you said, it's very, very complex because you have that monster under your bed for the rest of your life. It never truly ends, as you said, with the plethora of side effects and long-term medical conditions. And the anxiety piece, depression, and other mental health considerations are astounding. And one of the major ways in my own personal experience with my personal group of patients, is continually to support patients either by peer-to-peer connections that they never knew that they needed or wanted, uh, groups such as Worth the Wait, and also reframing knowledge, not only reframing it, but repeating knowledge is power. Knowledge is power. And so we're going to start to lay out a roadmap of, hey, this is when we're going to start thinking about looking for cardiac impact, or this is when we can start checking your fertility when at X, Y, and Z, and working with a provider that is knowledgeable in the long-term impacts that a cancer chemotherapy specific has. Not all oncology providers are versed in that. They treat you up front. They give you the medication, which is great, amazing, thank you. But thinking about the longevity and thinking about right now, yes, we're having more and more young cancer survivors and people diagnosed with cancer, but we have to think about this quality of life and the impact on not only the medical system and them. Navigating a medical system now is so complex because it's very siloed. There's no bridges. And how do you even navigate that? Because many individuals, when you get diagnosed with cancer, everything's in that cancer institute. One-stop shop. But after you're off treatment and in survivorship, you're now navigating multiple disease institutes or disease groups, cardiology, psychology, pulmonology, dermatology, nephrology. I mean, the list goes on. And for some people, it's one specialty, but some people it's 16 plus specialties. And how can you expect someone to navigate that?
Yeah.
And to but truthfully too, rewinding back a little bit, you go through the consent for treatment for your cancer and you're saying yes because you're like, hey, I want to beat this thing.
Right.
But you're not thinking about, okay, these are the side effects. I'm going to read you this 20-page consent about all the side effects. You're not thinking about that because they're also too hypothetical, like, oh, this could happen or it could not. So how do you really prepare one for that?
Yeah.
I-
Nexie,
And how
can I
could someone not have anxiety? How could you not?
right.
Yeah. Nexie, I was going to ask if we can go back to your comment about when you were diagnosed and I just want to get this out of my body. I think that is such a frequent reaction to a cancer
Right.
diagnosis, right? Everyone like, just get it out. And I want to talk about the importance of having multiple conversations about fertility, because I think some providers are better than others about, having this conversation. Sometimes it's driven by the patient. And if it's not driven by the patient, it never happens. But I think that, experts in the field of oncofertility now are saying this can't be a one and done. It needs to be multiple conversations throughout, because let's say the first line of therapy doesn't work and that was not specifically toxic to your reproductive organs. Well, maybe the second line is going to be more toxic. So let's have another conversation at that point in time. When you're done, let's talk about, maybe you didn't have the money to do the fertility preservation. Maybe you were too ill to do it. Maybe in 6 to 12 months after treatment, you'll have an opportunity, before you are entering into, menopause or whatever the situation is, with your cancer diagnosis. So I think that hitting the conversation multiple times can really help. And then the other thing is being partnered versus not partnered. I know in my personal situation with Mike, we were married, and he tells the story all the time. He's like, "Get it out. I'm done with this." And they were like, "You need to go bank your sperm." He's like, "I'm not doing that." And I'm like, "Yes, you are." So I think that conversation can really go different ways depending on if you have a partner, if you're single, how old you are. There's so many factors in that. And that's why the providers facilitating these conversations need to have it with every single person, regardless of anything. Because, like Kara said, it's a social justice issue, right? You're stripping somebody of those rights.
I totally agree with that, and needing like those multiple touch points, because to this day I will always wonder, because when my oncologist was telling me you're going to need 16 rounds of chemo and do you want to freeze your eggs, all in that same breath, of course I was focused on the chemo, because I'm thinking, how am I going to survive 16 rounds of chemo? That was children, fertility, freezing eggs. That was the last thing I was thinking about. And I always, this is part of like my personal advocacy. I wish someone had called me the next day and said, "Hey, you just heard a lot of information. I want to make sure that you're understanding the next steps. Yes, you are single, but here's the reason why we would at least like you to have a consultation, just so you're aware of what is out there, what resources are out there." So for me, I'll never know if there was time in between my diagnosis and then starting chemo. I still think I wouldn't have been able to afford it, because I'm the single person. It's a lot. Like, I think people forget it's not just the cost of your treatments. It's also your regular bills don't stop. Like, everything is, continues, and it's a deep grief that I do live with on a daily basis. And like you said, I always mention it to other young adults, and then I'll take it a step further, especially young adults who are Black or of color, because a lot of times too, we're dealing with implicit bias. And a lot of times, if they either see other children with you or don't see any with you, they don't even bring it up. And then when you bring it up, sometimes the way that conversation goes, it's like the doctor's cards are showing, and then you feel uncomfortable. And so how do we make sure that we're reaching the communities we need to reach to get this information and to get these resources, like Worth the Wait, out there? Whew, I take a deep breath after that. Oh,
It's so complex and it's so heavy. It's so heavy. There's nothing light about it. And I am gaining some more hope and momentum in the oncofertility space from a provider's perspective. I do think we're starting to come together and say, hey, how can we collaborate? And how can we start making a stance? Myself and a couple other colleagues came out with a paper to say, hey, sperm banking should be offered for all individuals born male at birth if they're past puberty, because treatment changes. Like, people change their minds about children one day or about parenting one day, and maintaining that option, you can always change your mind about, a couple of years of whether or not you still want to maintain that tissue. And that's another cost that people don't think about, is that maintenance of, hey, I have to pay this amount of money to keep my tissue frozen or my specimen frozen every year, which adds up if depending on how your age and how young you are, and just where you're at in life. And I do think it's exciting to see people family build later and later, and putting later and later, because they still feel like it's very young. But other people say it's old, but I think it's young. And so it is important for, I think the only way that we can truly advocate for people is having their voice be the heartbeat behind our advocacy. And I like I said, I have this just this faith that we're making some strides in an environment that feels impossible. But in regards to some of the social disparities that we see in this field, it's astounding. And so that's why and where myself and even our practice is, everyone doesn't like everyone gets the consult, whether you're low risk, whether you're high risk, if you're male at birth, offered the sperm banking or suggested to have the sperm banking. And I do feel that that is a common thread that most practices are starting to adopt. Is the medical field perfect and will be without bias? No. But I feel that we are making some strides in that realm.
Mm.
Yeah, that's so encouraging. And Kara, I tell you all the time, your where you work is just so fantastic as far as having everything in one place and working together so well. I think some of the stories that I see, there's geographic disparities too. There are certain states that have one fertility clinic, and patients are driving hours to get. We just got an application from somebody who 2 hours round trip every time they're going to the fertility center. And that's somebody who's lucky, who's had the conversation about it. You're thinking about all these pockets of people that are living in basically, fertility deserts that don't even have the option to have the conversation, let alone get there to, have a procedure done.
Mm.
And these
Go on.
These conversations too are so delicate that, I always encourage the oncologists, to give me a ring so I can have the conversation, because, I want to have the conversation. However, some of them just aren't comfortable or well-versed. And I'm like, okay, do you want someone not well-versed, like, answering some of those questions? No, but mention it and connect them to the right person. Like, let's try to build these bridges, as opposed to, and that's where I'm trying to reframe things in the oncofertility world, especially with oncologists' hesitancy, is, hey, you don't have to load it all on your back. Plant the seed, send them to someone like me, or send them to me, and we'll take the rest from there. Like, when can I start? How long can you delay treatment? And I think that's where it gets really complicated. Is I would love to talk to people about it for 3 weeks, 4 weeks, 5 weeks, but sometimes we truly don't have that time.
Right.
And so sometimes it is one conversation, and then you're off to either andrology or reproductive endocrinology and infertility, and that's that. So I struggle with that, because I always want more time, but time is essence in this situation.
Absolutely. As we start to wrap up this conversation, what, with someone listening to this, what are some takeaways that you would want people to know about the unique challenges of fertility that those diagnosed under 40 face? What are some, things, whether you are that patient or you are a family member, a caregiver, a friend, or like you said, in the medical community? Kara?
This is always a loaded question.
I know, right?
Loaded question. I think for someone who is either themselves, a partner, a friend, or a medical professional, it's the same theme of this is heavy and hard. Resources, resources, resources are always needed, no matter whether it's psychosocial, mental health, fiscal, it all ends up compounding. And so someone may be fine in that moment, but these are compounding and they are forever. And so having that check-in on those pieces, on those connections at every visit, at every girls' night out is extremely important because it doesn't go away. And I think that's one of the things that I would want to empower someone who is supporting a cancer patient is that it never goes away. So you shouldn't. You shouldn't stop asking the questions, helping the support, helping be that support and be that light. It's complex and sometimes people never know what to say, but sometimes just your mere presence is enough and gives enough of a motivation to be like, oh, hey, you know what? I am struggling. I'm going to do X, Y, and Z. I think so many, like as the medical system is so siloed, I feel like so many individuals just suppress it and silo themselves and try to get back to normal, but their normal is never going to be normal again. Yes, getting back to work is great. Yes, getting back to working out is great. Family building, amazing, incredible. But you still have that monster under your bed.
Very true. Megan?
That's such good advice, Kara. I think, if you're listening to this podcast, you already know how to advocate for yourself, right? Like you've taken that step and, I commend you on that. I think I want to leave with a message of hope of you're not alone in this. When I was going through it, it was like, let me have a friend of a friend of a friend who has a similar story. Those were the types of connections I was able to make to just find community in that. I think now it's even easier to do that. Certainly reach out to Worth the Wait if you need help financially, but also if you just want to hear an inspirational story of somebody with a similar diagnosis or a similar pathway to parenthood. We have hundreds of people and they all want to share their story and they all want to help. So if you need just an uplifting message, feel free to reach out to us for that too.
Thank you both so much for this needed conversation to highlight fertility struggles, in the AYA community. And want to make sure that everyone knows we will again put this both on our website and in the show notes. More resources on fertility preservation grants. Make sure to check out Worth the Wait at worththewaitcharity.com.
Worth the wait.
Right. And then also to more information on our resources, please go to sharecancersupport.org. Just really want to thank you again for your time, your expertise, and just the compassion, and more importantly, the hope, and that a good reminder in this space is that we are not alone, and it's okay to ask for help. And these will be tough conversations and talking about your fertility, because we're thinking about the cancer. but it is important to at least know what your options are. Thank you.
Thank you so much.
Thank you.
The staff recording.
I'm
Yes.
sweating.